Late Night Health continues. I'm Mark Alyn. During our second hour together, we're going to be talking with Abby Myers, who has a new book out, Orphan Drugs, A Global Crusade. We'll talk about, she founded an organization called NORD, N-O-R-D, National Organization for Rare Disorders. And we'll find out more about that coming up here on Late Night Health during Hour 2. Right now, we return to Margaret Overton, whose new book, Hope for a Cool Pillow, is a must-read, I believe, for anybody who has elderly parents, relatives, or has been diagnosed with something catastrophic and are looking and planning for end of life. I had an interesting experience. My mother, it'll be 11 years, my experience was my mother had a moment of cognitive acuity. She hadn't been talking to the doctors at all and turned to the doctor and said, why am I here? I want to go. It's over. And he told me, he said, I'm going to have hospice contact you. I said, she's, 12 seconds worth of not thinking I was her fat dead brother, and all of a sudden I'm talking to hospice. We didn't need it, but is that true that you if somebody is elderly, they're sick, and they say I want out, boom, the doctors say go to hospice?
I'm not familiar with that particularly, but I'll tell you that in my experience, I have seen incredible clarity about 48 hours before my mother died, before my father died, before my brother-in-law died. So there is a coincidence there, yes.
Right. And it was interesting. That was a Wednesday. She passed the following 10 days later, and she wanted out. She really did. And I as her guardian, I was obligated to do what she wanted me to do.
Right.
My point is that it was done through the hospital that she was at.
It was through the hospital.
It was through the hospital. Hospice hospice services were provided as part of her Medicare package.
Right.
And which I appreciated. There was no additional money that she had to spend. But at the same time, I found it a little cold that, says I want out, and boom, we got to talk about it.
Well, I think that it's not an uncommon thing that when someone makes up their mind, you are more likely to see them pass within a matter of a shorter period of time.
Right.
And I saw that with my dad. My dad had cancer and he was completely with it, but he got into bed. He stopped eating. He got into bed and he died 5 days later. That was that.
Wow.
My mother had dementia, and so it was a little bit more confusing. But she also stopped eating, and I would say it took about 10 days after she stopped eating. And we couldn't get her to eat or drink, but
right.
I think that it's more than a physical thing. I think there's very much a spiritual aspect to it.
I was going to ask you about that.
It feels that way. When my brother-in-law recently passed, he was not ready to go, and it was a much different experience for all of us. He was younger, and he had cancer. It was very difficult. He had a very hard death. And,
right. He didn't want to go.
He didn't want to go. He wasn't ready, and so it was difficult for him to let go.
There's so many things that I want to talk about. We'll have to have you come back. One of the things that I wanted to ask you is that as an anesthesiologist, you're putting somebody out for a surgery. Do you ever get asked, can you throw in a little bit more juice there and they don't wake up? Because we know that they're not going to be around much longer.
Well, it's actually very common. So what we have in our hospital is our orders, what we call LET orders, which is limitation of emergency treatment. It's like a DNR.
Right.
And so when patients come for surgery, our hospital policy is that we rescind that order in order to do the procedure. And then we will reinstate the order when the patients leave the recovery. And so many times family members will say, how about if something happens, you just let them go.
Wow. We're going to have to continue this. This is a big issue, especially with the graying of America, I think. Margaret Overton has really put together a memoir that I think you'll find very, very personal and at the same time something that can be useful to you. I'm Mark Alyn. The name of the book, by the way, Hope for a Cool Pillow. I'm Mark Alyn. Late Night Health continues. Join us at latenighthealth.com. More coming up. Don't go away.